Well, good afternoon, everybody. It's great to have you with us. We have a wonderful hour-long webinar presentation from one of our great aromatherapists, Jessica, and she is the founder of Aromatic Healthcare and has been a great partner with us on this aromatherapy journey with Benedictine over the last 4 to 5 years. As many of you know me, I'm your host this afternoon, Dr. Neil Budenseek. And it's just great to have you joining us today. We're going to focus in on the Benedictine Well Kit, specifically the aromatherapy intervention, and all of the diversity of products that go along with that. The other thing I'll just housekeeping wise is we have I'll be taking and manning the live Q&A chat box. If you have any questions, feel free to share those as the talk moves through. And towards the end, we'll have some time. We had a good amount of time this morning to be able to have some dialogue. And don't be afraid, any question within the area of non-pharmacologic interventions and aromatherapy is on limits, in limits. So go ahead and share those. So I think without any further ado, I'm going to go ahead and welcome Jessica to the presentation on aromatherapy refresher. And welcome, Jessica.
Thank you, Neil. And hello, everybody. Thank you for coming this afternoon. I just want to let you know that I have a little bit of audio trouble, so I'm using a microphone, but I can't hear anything. So definitely, if you have questions, type them into the Q&A and we will answer them at the end. So I'm just going to literally start talking and again, can't hear anything through the screen. So like I said, gather your thoughts, type them out, and we will make sure to address them at the end. I am going to share my screen with you. I do have a small slide presentation, and I'll be going back and forth between that and the poster, if you're familiar with poster, that corresponds with your aromatherapy kit, and myself. So bear with me as I toggle back and forth and share my screen. We're going to first take a look at this slideshow. Thanks, Neil. Neil's confirming I'm on track. So welcome to this aromatherapy refresher. I started this last year with the intention of bringing communities back together over the topic of aromatherapy, because I know that there is, well, especially in the last year, we've had a ton going on that has probably sidetracked us from some of these really great tools we have available. And I know there's a lot of turnover and leadership changes. So I wanted to start doing these refreshers. I did one last year, like I said, and I want to start doing them annually or biannually to just keep communities engaged with the aromatherapy portion of their well kit. So what this is about today is just refreshing communities on the aromatherapy that has been curated for Benedictine, what's in the kit, how it works, how to utilize the poster and the guides that have been available or made available to you, and to just do an overview of the safety information. And also an opportunity for you guys to ask any questions that may have come up, or if you are struggling to keep your program going and think you need more training, we are always available to do that. What this refresher is not is actual training. So depending on where you are in your Benedictine journey, you may have gone through training already. If your community has not or is struggling, like I said, we can talk about that later. But right now we'll just be going over the products and how they work. I also will at the end be leaving my information again with you guys so that you'll have my email, my website, and know how to order product if you need to replenish anything, and how to get in touch with me if you do have any, concerns or questions down the road. So I'm going to start with just I'm going over exactly what is in your kit. So when I began working with Benedictine on a global scale, so among the whole organization, we really worked hard to find the best products to address the needs of your residents and staff. So what we did is we pulled together pure essential oils, massage oils, and we have since sort of tailored this kit even further and eliminated some of the products we used to have, which were aroma sticks. They're little personal inhalers. Doesn't mean they're not still available. They're just not something that we cover in training at this point, just because not a lot of communities use them. Some communities love them, some communities don't really seem to find them beneficial. Now, most communities should have one large automated diffuser. The automated diffuser is a programmable unit that you program, and then it's very powerful, and it works sort of like a thermostat where it turns on and off and diffuses aromatherapy into a common space. They're amazing. They're great, and I hope you're utilizing them. If you have a machine and you haven't replenished the oil in a while, or you ran out and you haven't got it up and running again, we can also help you with that. Between Dr. Budensik and myself, we can program them or replenish the oil for you. You just need to let us know. And then along with the kits, we also provided 3 small diffusers. Those were intended to be used for personal use for an individual, like in their room or in the bathroom to help, facilitate bathing. They're meant to be portable. They run off batteries. All communities were given at least 3. Some have more, some have ordered more over the years. Again, those are always available if you do need more. But in general, the kit includes the pure essential oils, the massage oils, the large automated diffuser, 3 small diffusers. Some people, or some communities, I should say, are also using large water diffusers. So those are like these, where water goes in and then mixes with the oil and diffuses. I want to distinguish the difference right away between an essential oil and a massage oil. So when I refer to essential oils, I'm talking about 100% pure essential oil that comes in a smaller bottle like this. If you open it, and this might seem elementary to you, but it's really important that we distinguish the difference for anybody that's not familiar with the aromatherapy kit. So a pure essential oil bottle is going to have a dropper like that on top, whereas a diluted massage product is going to come in a much larger bottle with a little disc cap so the oil can be poured out. The difference is this is pure, this is not. This has been diluted down so that you can use it topically on the skin for massage or in the bathtub under warm running water. So I want to make that distinction right away, because these should never be used topically on the skin, particularly when we're talking about clinical aromatherapy in a healthcare setting, which is what you are doing, is clinical aromatherapy. We need to administer aromatherapy on the conservative side. There's a lot of companies out there and a lot of information on the internet about aromatherapy, which is why it's so important for healthcare facilities and elder care, senior care, to really get proper training and utilize an expert such as myself versus just go to the internet. Because on the internet, somebody might say, yeah, you can use this on the skin, and lots of people do, but that's completely different from what we're trying to do in a clinical setting with the elderly that are in memory care or, approaching those last few years of life where we need to be very careful. Okay. So I ask that people leave their home aromatherapy life or their internet aromatherapy life at the door when they come to work and embrace this more conservative approach in the healthcare setting. So no pure essential oil on the skin ever. We also never ingest essential oil. Again, there's lots of information out there, but in the clinical setting, we want to make sure that we're not utilizing it that way. So pure essential oil, topical aromatherapy, massage. All right, I'm going to toggle back to my presentation. There we go. All right. So the first thing so the way this refresher is going to work is I'm going to go over the oils and the poster that you have all been provided at one point or another. And if you don't have it, we can get you another one. We can also get you a copy of it, a digital copy, so that you can print it and use it as you'd like during trainings, onboarding. In fact, I highly, highly, highly recommend that you go over this content in your onboarding of new employees. When we put this together, everything we did aligned with what Benedictine wanted to see happening for their residents, right? They wanted to have these non-pharmacological, non-pharmaceutical options for their residents. And that didn't just include aromatherapy, that's doll therapy, music therapy, and so on. And so all of this has already been incorporated into policies and procedures. And thanks to Dr. Budenseek, you have standing house orders for symptom management. And so you don't actually need a doctor's order to administer aromatherapy. And we have put together this kit, along with this guide, to make it very easy for you and your staff to do this, so that it's not overwhelming or rocket science. That's why we've honed in, 6 oils, addressed very specific symptoms, and made the material very clear and concise. So on the poster, you will see it is laid out with levels, observations, oil, safety information, and method. And so I move to the next screen. Hang on. We'll get to the poster. All right. So the poster, this is the poster. So if you haven't seen it, this is what it looks like. You might have this posted in your community somewhere. And like I said, if not, let us know. So in the kit, we have lavender, happy, tranquility, tum-ease, and expand. Those 5 oils are pure essential oils. Then we also have warm relief, which is a massage oil, lavender, and happy, that also come as massage oils. So each of the levels that are assigned to the first 3 oils are not necessary, but I put them there so that you would have options. It's really important to have options. So if you have a resident, for example, that is struggling to transition into assisted living, they're emotional and they don't want to be away from their family or leave their home. I'm sure we've all been there before. I know I'm going through it with my own grandmother right now. I always say, reach for the lowest level first. Lavender. Lavender is generally appreciated by everybody. It's one of the safest oils. It is the most utilized oil in the world, and for good reason. Lavender is a great balancer. So if someone's really depressed and weepy, it can lift their mood. If someone is exceptionally anxious and irritable, it can help bring them down a few notches. And of course, it has a ton of other great benefits, which we'll go over. But that is why that's a level 1, because it can be used in virtually any circumstance to make life better. If I don't have anything else in my life, I always seem to have lavender somewhere, and it seems to do the trick. So keep that in mind. If you have, you can tell your staff, if you really don't know what to do, but you just want to do something natural to help your resident, grab some lavender. Happy, on the other hand, is going to be more of it's stronger, and it's more of an antidepressant. It has a few other benefits to it as well. And so I always use that as a level 2, because if lavender's not working, then step it up a notch. We also have these levels so that or these 3 different oils that all are kind of similar but different, so that we can find what works for our residents and also rotate different things out so that they're just like a medication they can become accustomed to, and it cannot work as well or become less effective. And so it's helpful to rotate the oils. There's certain things that I won't be going over today because that has more to do with an official training. And so that in the interest of time, we won't be going over everything, but just know that those 3 levels are there for you if you choose to use them to assess your resident. On the poster, so as you can see, we have the oils are all listed. We have a list of observations. These are specific to the elderly community. So that doesn't mean that's all the oil is good for. It just means that those are the specific observations your staff might be making. Oh, my resident's falling a lot. I'm going to try to put some lavender on a cotton ball every day and see if that helps them. There's no safety concerns, and they generally tolerate lavender. Okay. Or, gosh, my resident is so agitated all the time at 3 or 4 o'clock. I'm going to put Tranquility on a cotton ball and see if that helps them, right? So we're using the poster, we're using the information to help assess what they need. On the poster is also the safety information. Like I said, I'm not going to dig into that too much right now because, for example, Tranquility says perform skin test before topical use. Well, we don't actually use Tranquility topically. We have it in its pure form in a bottle of pure essential oil, not a massage oil. However, in advanced training, I teach you how to dilute oils and make your own preparations. Should you choose to use Tranquility topically, you would probably want to perform a skin test to make sure your formula is made properly and not going to irritate your resident's skin. But again, that's something we would go over in training. And then if you go to the last column, it references the various different methods. So each symbol obviously has its own meaning. A nose is associated with inhalation, and that's referring to oil on a cotton ball or oil from an aroma stick if your community chooses to use them. So that's called direct inhalation into the nose, versus diffusion, which are those 3 squiggly lines where we would actually put the oil in a small or large diffuser and use it in a particular space. The hand reference is topical, and that's when we would reach for the bigger bottles of massage oil. And same with the bathtub. We would be using that diluted essential oil in the bathtub. So if you had somebody that was really achy, for example, you might put a little cupful of warm relief in their bath to help relax their muscles and soothe their aches and pains. So this chart is just packed full of information, pretty much everything you'd need to know to just go without any real in-depth training. So it doesn't mean that it's you don't need to be trained. It's just simply a good guide to refresh yourself, refresh your staff, and keep your staff engaged with the aromatherapy program at your community. And if they forget something, this is something that can help build confidence and also reduce the anxiety if they don't feel comfortable administering aromatherapy. That also comes in a smaller foldable little guide that they can put inside their name badge. So if you don't have those, we can email those to you. They're nice. You just fold them up and they fit very nicely and have all the same information. So if someone wants to whip it out and read it and figure out what they need for their resident, they can do that. So that's the poster. Again, the observations that we have listed here, these are simply some of the observations that or symptoms that we're trying to address with this kit, not a comprehensive list of everything that the oils do. And so back to this here. Okay, so lavender, for example. Lavender, like I said, balances emotions. It's relaxing. It's good for anxiety. Can we see it, Neil? Neil popped up for a second. I think he is trying to tell me something. Can you see the poster, or could you see the presentation?
Not I was seeing the poster. So yeah, if you want to flip to the
Okay.
presentation.
All
Cool.
right. I'm talking about good old fashioned pure lavender, right? Affordable. So of all the oils, it's one of the most affordable, generally appreciated by everybody. And I say that, but of course, there's always that one person that hates lavender. They've smelled it too much, they're over it, or they're sensitive to it, or whatever. And that's true. That's very much a reality. So if you have anybody like that, we need to be mindful of that. But in general, it is, like I said, kind of a panacea in the aromatherapy world. My lavender comes from Bulgaria. All my oils are sourced from really high quality aromatherapy sources versus there's a lot of inferior product out there. So even Whole Foods oils, which, you know, we think of Whole Foods as a nice organic grocery store that should have high quality. Well, they don't. Their brand of oils is nothing compared to this. And I don't mean to toot my own horn. I'm just, this is my job. This is my business. This is my passion. And I need to make sure that my oils are being used in the clinical setting, that they are clinical grade. So high quality organic lavender oil, one of the best I've ever laid my little paws on, and it works great for everything. While I'm still on screen, you'll notice that all the oils are color coded, right, to correspond with the poster. So again, we're making it as easy as we can so that it can translate across culture, across, you know, different levels of experience. Everybody learns differently. So hopefully between all the different ways we've tried to perfect this, that it should be pretty easy to utilize. So I'm going to move back to my presentation that you couldn't see anyway. There we go. Lavender. It's great for insomnia, headaches. Beyond the clinical setting, I use lavender for everything: sunburn, skincare, bug bites. On the chemical, there's like a way to analyze how a chemical works. And on the chemical scale, it's very neutral. So some are very stimulating, some are very relaxing, some are very crisp and sharp, and some are very mild. And so there's this big chart where we plot essential oils, and lavender falls right in the middle, which means it can really help with anything, like I said. So moving on, the next oil is Happy. Hopefully you can see how happy this gentleman is on the screen. And Happy is exactly that. It's a happy oil, and that's the intention behind it. So in addition to a little bit of lavender, it also has mandarin, which is the sweet, well-rounded citrus. Most people know what a mandarin is. The oil comes from the peel. Children love this oil because it smells like candy. And it's really great for the digestive system. It's really great at just calming down angry, depressed people, frustrated people. And so it's just a happy oil. Then there's marjoram, which is incredibly relaxing. It's also great for muscle aches and pains and the respiratory system. And then there is a little bit of Roman chamomile, and that is a very sweet, almost intoxicating oil that creates quite a bit of euphoria. So in the blend, it's probably one of the fastest acting aromas. When someone smells it, it instantly can create a sense of euphoria. Whereas, you know, that's why it's a great one for children, because in fact, the blend used to be called Happy Kids, and then I changed it to Happy because it actually applies to everybody. But it really helps you feel better right away. Some people have said that it helped because of the sweetness. It can kind of jog fond memories of candy and sweet beverages, which is great for the elderly, right? Like anything, smell is the most powerful connector to our memory. much more so than even sight. So you can show someone a picture and they might not remember what's in that picture, but if they smell spearmint gum, spearmint, they might remember the time that their grandpa gave them gum when they were 10 or something. So that's what the beauty of the aromatherapy is, that it can really help jog the memory unlike anything else. So this blend in particular happens to be kind of a multi-tool. I think of it like a Swiss Army knife because it's, of course, great for the mood, but it also, the same oils that are helping, lift the mood also happen to be really good for aches and pains, also happen to be really good for digestive issues. So if you have a generally crabby person and you don't know what's going on, giving them like a neck massage with some happy massage, that's why we have it available in the massage oil, with some happy could totally change their day around. Putting a couple of drops on a cotton ball and pinning it to the inside of their shirt could really make a difference. And again, it's stronger than lavender on its own. All right, next oil is Tranquility. Oops, Tranquility. That is the purple bottle. So Happy was green, Tranquility is purple. This is the strongest oil in the kit. In addition to lavender, it has Lang Lang. Lang Lang is a powerful, intoxicating floral. It's really, well, it's not in there in full strength, so no worries about it being too strong, but it is really good at lowering blood pressure. So in addition to just being able to relax and de-stress and ground a person, this blend is actually subtly working on other things. And that is, again, another beautiful benefit of aromatherapy. Just by using it, we're de-stressing, we're enhancing our immune system, and quite possibly helping our heart, in the case of Tranquility. Clary sage, fabulous for sleep, depression, lowers cortisol levels. Marjoram, again, very relaxing. Frankincense, just good for the soul, grounding, helps with focus. And vetiver, which is a grass that comes from India that is grown to help keep the ground together. So very strong roots, to prevent erosion. Actually works just like that in the natural medicine world. Vetiver is very grounding to the body and helps keep us put. Which is why this oil helps for those who are prone to falling, because it's good at helping them stay grounded, balancing out the blood pressure, and keeping them, less agitated in their seat, really. So this oil, not only is it fabulous for sleep and the higher agitated residents, but it also helps with staying on task, which might sound contradictory because it helps us sleep, but what it does is it helps ground the body, slow down the brain so people can focus and they're not getting distracted by, Miss Wilson over here who's, maybe bugging somebody else, or that person's family members visiting. It helps people stay on task and stay grounded. It's great to use during sundowning. And again, this is the strongest one, so I would reserve it for those times later in the day, for the highly agitated, or like I said, if you have somebody that really has a hard time staying on task or falling asleep. Can be used in a personal diffuser. I think it's a great one to really tailor to people that need it versus the whole group, because it is so sedative. And again, we tailor by adding oil to a cotton ball and pinning it to somebody's shirt on the inside, where they, like near the collar, where they can't quite get at it. And it's, still keeping in mind their dignity, so they don't just have something stuck to their shirt. And again, is close enough to their face so that they can get the full benefit of the aroma diffusing toward their nose. So that's Tranquility. So those are the first three oils. They all have, between lavender, Happy, and Tranquility, they all have similar but different effects. I'd like to move on to Expand. That's in the blue bottle. And this one is completely different. It has the crisp, uplifting citruses. So unlike mandarin, which is really sweet and round and relaxing and soothing, grapefruit and lemon are more antidepressant, uplifting, stimulating. Can really push a person up and out of a bad mood quickly, in a uplifting, refreshing sort of way. Um, and then it also has rosemary, which is fabulous for the memory. Lots of studies coming out about the effect of rosemary on the brain. Great for viruses, um, and deeper breathing. It's just a great mental stimulant. And eucalyptus, we are all familiar with eucalyptus. This is a mild form of eucalyptus in this blend. So not, there's some very powerful eucalyptus out there that can be a little jarring to sensitive lungs. So I have elected to use a more mild species of eucalyptus in this blend. But it's great. It still helps open the lungs, expand the mind, um, and uh, actually has a little bit of a effect on the blood pressure as well. It helps to lower blood pressure as well. And then peppermint. Peppermint's great for headaches, allergies, any sort of congestion issues, and in general, a great stimulant to the brain. So you can see how expand is going to be used in kind of the opposite circumstances, where you're actually trying to maybe perk somebody up a little bit if they seem a little sleepy or out of it. This would be a great oil to grab for that. It's anybody that's suffering from any type of illness or congestion, this is a great oil. If they have anything like COPD or some other asthma or something similar, just use caution. I don't want to say don't use the oil because I have so many customers that have benefited from expand that have really bad asthma. And so I don't want to say you can't use the oil. What I'm saying is don't just cloud up a room with a diffuser full of expand and until you know how your resident reacts to it, right? Put a little bit on a cotton ball and maybe waft it near them and see how they respond before going full bore. So that's my advice there. This is great for, like I said, anybody that's in a bad mood or needs a little stimulation and a little lift out of their slump. Think using it during activities to keep people motivated and stimulated. And even, during, I think, like singing activities and stuff where they need to use their lungs a little bit more. This would be a good one to diffuse or otherwise administer. The next oil is Tummies. That's in a yellow label. And this is exactly what it says. It does exactly what it says. It eases the tummy. Um, so we've got some citrus oils in there that are really good at stimulating digestive juices, getting the digestion moving, spearmint as well, ginger and nutmeg. All these oils, the way that they work on the digestion is pretty fascinating. So not only are they uplifting and stimulating by their very nature, but they actually stimulate the brain to produce digestive juices. So most often when someone's having a digestive issue, it's because their digestion isn't working or it's slowed down. And that can happen from, medication or just long-term poor appetite, bad eating habits. Um, and of course, we get nausea, post-operative nausea in the transitional care units, a host of different issues, but they can all be addressed by this oil. So the same oil that can help calm a digestive upset or improve digestion in terms of like constipation and diarrhea and things like that also can stimulate the appetite just because of the way the oils work. So it's kind of a multi-tool again for the digestive system. So any digestive complaints can be addressed by this oil. If you do have residents that are having a hard time um, keeping their appetite stimulated or don't seem interested in eating, I suggest either putting some on a cotton ball and really tailoring it to that resident, or diffusing in the dining area, 20 to 30 minutes before mealtime and during, so that when they get there and they sit down, that space is already full of tummies. No harm in everybody smelling this oil because it smells great. It's kind of like, it's like I said, it's like a sweet mixture of spearminty, sweet, spicy. It's good. And it's really, it has other benefits too. It's good for fatigue. You know, ginger and nutmeg and lemon, they're stimulating to the central nervous system. And it can help with focus and such as well. So keep that in mind. That's why it's a great one to diffuse during mealtime, so they can stay focused on their food and their digestive system is being stimulated, making them want to eat. I do know that they've done, this mixture is based on my research on oils for all digestive complaints, but I do know that the community of Innsbruck studied orange oil on its own and found that it had a really positive impact on appetite. So for what it's worth. We covered tranquility. I think that was, so the last oil is warm relief. And warm relief actually only comes in a massage oil. Some of you might have smaller kits that have a pure warm relief in it, but in general, most communities are only using this. I do like to diffuse warm relief. It smells great. It's very stimulating, and it helps people get up and move. It's a great oil for that. But in the kit, we only included the topical preparation. So you might have this, but don't use it topically. If you do, use the massage oil. Okay. This stuff is great. I actually have it in a roll-on as well that my company sells, and I have it in my purse all the time just because it's great for any ache or pain or headache, or it's just all around a great oil. We had a community actually report back with this oil. They were using it with, I'm trying to get my screen back up, bear with me. They were using it with a resident that had lymphedema. And I'm not very familiar with the process and procedure of treating that, but I understand that you wrap the legs with wraps, gauze wraps, and you know that the lymphatic fluid can come through the skin, right? Not pleasant, but a reality. Well, the oils in this blend are fabulous at helping the lymphatic system. So she found that when she used warm relief when wrapping her patient or resident's legs, that she had to change the bandages more often, which, although was inconvenient for her, it was great for the resident because it meant that the lymphatic fluid was draining, it was coming out, the swelling was going down, and that's exactly what I would expect with these oils. That's not why I formulated it, but when I found that out, I thought I have to share that story whenever I have a chance, because I know it's something that you guys run into a lot. So warm relief is intended to warm the body and relieve it. So again, we've got lavender and marjoram in there because they're analgesic, they're muscle relaxing, and pain relieving. And then we have rosemary in there. It's stimulating, it stimulates blood flow, which is important for healing. It's important for, it's also very anti-inflammatory. So it's going to help reduce inflammation. And then juniper berry is great for like rheumatic conditions, rheumatoid arthritis, arthritic conditions. And it is a powerhouse at the lymphatic system. So that is why it works so well with lymphatic conditions. And then there's black pepper, which is incredibly analgesic. It's very stimulating, and it helps all these other oils work better. So it's like what we consider an enhancer. It enhances the properties of the other oils. The blend itself is very revitalizing. So I like to give massage with warm relief to get myself moving. Even like I'll if I have to go do some physical exercise or anything, I like to use it beforehand because it really stimulates blood flow and encourages people to move. So if you have kind of like a a sluggish person that doesn't want to participate, or somebody that maybe is going through physical therapy, this would be a good oil to use for that. And again, just general aches and pains, pain relief post surgery. Obviously, we're not going to put the oil on the surgical site, but say they had a knee surgery, you could always rub the oil on the sides or the back of the leg, because it will get into the tissues and the bloodstream and the local area and help relieve pain, swelling, improve circulation so that healing can happen faster. So just a ton of benefits with this concoction. Like I said, I don't leave home without it. And it's also another one that can be used in the bathtub because it is in that diluted form. So never put pure essential oil in the bathtub, always dilute it first, which is why we have these great dilutions available for you. So those are, let's see, where am I at on time? So I'm going to shift gears real quick. So we've covered the oils. Those are the oils in the kit. That doesn't mean you're limited to the kit. I do have a whole set of offerings on my website, but these are the oils that have been contracted with Benedictine so that your communities can save some money, get bigger sizes. And like I said, there's contracted pricing on those. So if you want to replenish any of the products I just covered, those you'd need to email me, and I will share that information at the end of this presentation. You'll need to email me about those. If you wanted to check out all my offerings, you could go to my website and see what else is available. I have plenty of communities that use oils outside of the kit, but again, the kit is designed to be simple and elegant and efficient. So if you have a community that's struggling or has some turnover or hasn't done this in a while, I always suggest you start here and then grow from there. So now we're going to shift into just some basics on safety. I think I've said it a few times already. Never use undiluted oils directly on the skin. Never ingest oils. And always try to work in well-ventilated areas. I know that some of the buildings are old or maybe not as good ventilation, but nonetheless, just always make sure that your less is more. In my full training, we go over that. We go over the chemistry in depth. We talk about, or in more depth, I should say, we talk about why these oils are so precious, what makes them so precious, how you really don't need that much, only a drop or two. And if anybody's worked with them before, you know, if you use too much, everybody knows it. So be mindful, one drop at a time. And follow the diffuser instructions for your diffusers. All the diffusers I provide are the same. So the information on the poster is accurate as it relates to my diffusers. Should you choose to use the oil in a diffuser that I've provided, the instructions are right on the poster. So of course, store the oil away from residents, but yet make them accessible for staff. So that means don't leave a bottle of oil on your resident's nightstand. But we talked about this morning, and we've talked about it before in different trainings, other trainings, about how important it is to make sure that these oils are accessible to staff. Otherwise, they won't get used. If it's too complicated for them just to get an oil, then the program doesn't really take flight. So away from residents, keep them away from heat and light, close the bottles tightly after each use, and make sure to keep your SDS sheets on hand. All communities have already been provided with SDS sheets, but if you need another copy, I do have digital copies I can send you. And I think I covered this already, but all communities should also have a policies and procedures and a standing order so that all of this stuff is incorporated already into your organization. Other things about safety, if there ever is an issue with these, like say you get some essential oil in your eye, first instinct would be to flush it with water. I mean, that's what we do when we get stuff in our eyes. But I'm going to tell you not to do that. All kits also came with a fractionated coconut oil. That's pure liquid coconut oil. Okay. There's no essential oil, no aroma in here. It's just plain inert coconut oil. If I were to get something in my eye, or a resident got some essential oil in their eye, I would rub it with this. The carrier oil dilutes the essential oil and slows absorption. Whereas if I were to have used water to rinse my eye, I would encourage absorption. So it would actually force the oil into my eye more if I used water. So first we dilute with this. Same goes with the skin reaction. If I use something on my skin and my skin didn't like it, I would rub it with this before I wash it off, because that will help dilute it and slow down the absorption into my body and into my skin, really. And then I can proceed to use some warm soapy water to wash it off. So always make sure, no matter what you're doing in your communities with aromatherapy, that you have a bottle of this around for safety purposes. In our full training, I do offer, or I do talk more about how to dilute oils and use this to make, to cater and tailor even further to your residents. But that's not something, like I said, that we'll cover today. I think that's it. Let me just find, oh, there we go. So we covered policy, procedures, safety. I just want to make sure, I don't have a cotton ball with me, but I just want to make sure everybody understands what I mean by the cotton ball method, because it really is one of the best methods. It seems kind of maybe clumsy or not as like sophisticated, but it really is one of the easiest, most affordable ways that we can administer aromatherapy directly to one person safely. And all that means is you take a bottle of the pure essential oil, and with that dropper, you drop 1 to 2 drops on your cotton ball, and then that cotton ball becomes its own little diffuser, and the aroma can affect your resident very easily. As we pin it or tape it to the inside of their shirt, it floats right up to their nose, gets into their olfactory system, and mostly is contained to their person so that it doesn't necessarily affect everybody. So that's the cotton ball method. It's tried and true, affordable. Like I said, I mean, everybody's got cotton balls at their communities, and there's nothing fancy or extra that needs to be ordered. So yeah. And then the second most common way that communities are administering oil is through massage. So I strongly recommend that, because that's not just aromatic, you're getting it on the skin, into the tissues, and you're adding that element of touch. Now with COVID, I know everybody has different expectations in their communities. I know some communities are still touching their residents, and I think that's great. Or again, I hope, if there was a period of time where they were trying to avoid that. But it's very important. That element of touch is so important to them. So I encourage it. Yeah. And so that's it. I'm all yours for questions, you guys, if you have them.
Well, thank you so much, Jessica. As always, a really informative and engaging presentation. And we'll open it up, as she said, for questions. I have a couple that I've pre-planned, just as people get their minds thinking about what other questions they may have. But I want to just, this one question that's out there, you covered it right around the same time as the question came out, but I just want you to maybe reinforce this. So the question was, do you use the massage oil in the bath, or some from the small bottle, which is the pure oil?
Right. No. Don't put your oil in the bath. Yeah. And it actually, right there at the bottom of the post, comes off of how much to use on a standard bath.
Jessica, I think the mic slightly wasn't catching, I don't think. You want to say that again? I'm sorry.
Okay, so no, don't use pure essential oil in the bathtub. Okay, I made the mistake like 15 years ago of putting peppermint in my bathtub. No, not fun. But in general, yeah, no pure essential oil, just the massage oil works as a bath oil. And it actually tells you exactly how to do it right here on the poster under the little bathtub symbol. Okay.
Awesome. Thanks for attendees that are giving some positive feedback. Just wanted to thank Jessica for being on this journey with Benedictine. So it's wonderful. I'm going to ask this question. I asked this morning, and it's around the sense of smell. And, you know, we know many people, unfortunately, that contracted SARS-CoV-2, COVID-19 infection. They perhaps lost their taste and or their smell. And so we have had people that have asked before, you know, if I or my resident or family, you know, can't smell or can't smell very well, will the essential oils still help, still work?
Right. That's and in all of my study and training over the years, it has been emphasized to me that first and foremost, just because a person doesn't have a sense of smell, which is not uncommon as people get older, doesn't mean that aromatherapy doesn't work on them. Okay, it's still getting into the body. And we have to remember that, like, when we smell something, it's getting into our body, it's getting into our bloodstream. So just as much as we love the smell of aromatherapy and the way the oils work, let's keep that in mind when we smell bleach, right? It's getting into our body. And so we need to be mindful of, you know, what we're inhaling. But to answer your question, I actually just did some olfactory training with another expert like myself, and we were working on how to rebuild the sense of smell after a COVID-19 infection. And the answer is yes. Yes, you can restore your sense of smell. It is just like any other exercise where you need to strengthen and work your sense of smell. From my research, one of the main factors in why people lose their sense of smell, and it's actually also why they get sicker than, if you're zinc deficient, you can get sick easier, right? Zinc deficiency is also connected to a loss of smell or less sense of smell, weak sense of smell. So I always encourage people to supplement with zinc. But from the aromatic side, that's like a crucial part of rebuilding the sense of smell. So I always suggest using pure oil, not blends, because blends are too complicated for the brain. But you can practice smelling. It's better to put it on a cotton ball and put it inside a jar so it can diffuse out, versus be stuck inside the bottle. But then you sit and you smell, and you don't just huff once and put it away. You actually mindfully sit with the oil and smell it and allow it to come in and out. And like I always, like when I've struggled with the loss of sense of smell. So I had started doing this years ago for myself. And I always used one citrus, one, like, from the different families. So I'd use like a lemon, I'd have a eucalyptus or a peppermint, something stimulating. I'd have something like frankincense that was kind of earthy, and then a fourth oil of some type, right? Floral, for example. So my brain could differentiate the smell and then become familiar again with, what does a citrus smell like? I've never fully lost my sense of smell, but because I am an aromatherapist working with oil all the time, I have significantly reduced my sensitivity and had to like take breaks and rebuild and all of that. And so in the case of COVID-19, I did this workshop, and she described exactly what I had already been doing for myself over the years, which is that just very, very simple but dedicated time to smell.
Thank you, Jessica. We have, it just shows, you know, I think the only, and this is a great question. The only way that perhaps a resident, I'm thinking myself as well, you know, if I had 2 rhino rockets stuck up in my nose where there's no way that the aroma can get to the olfactory bulb, and remember the olfactory bulb and that area is very, very thin, and that's the pathway of least resistance. to be able to get these essential oil molecules, circulating into our human bodies. And so it's not just smelling it, it's actually what's going on beyond the smell itself. But a great question here. We're wearing masks. How are we supposed to use essential oils? Because we have masks on, and our, residents may have masks on. I'm going to take one crack at this because it's a very great question. I mean, number one is last night, I'm going to give you a little personal information. Last night I was at a church service for Lent, and I had my mask on, and yet I could smell the incense, because that's part of the Orthodox Church's liturgy. I think the same applies, with our aromatherapy. It's not to say that if a resident is in their room on their own and they're, having an evening of getting ready to go to bed and sleep, doing a personal diffusion, they don't have a mask on. I think if they're out in the public area and they do have a mask on, still doing the cotton ball method is a great choice. I think, we'll all be able to still smell it to some degree, or at least have it go around our mask, unless you're wearing an N95, which, filters out 95% of those molecules. But bottom line is, I think it still can be of help. It may not be quite as easy, but I think it can still be useful. And then the other question was around, how do we do massages if we're not allowed to touch residents? Now, that's an interesting question because I think where we're at with that is we haven't for the last year not had our residents getting bathed, right? So we're doing some amount of touch. Certainly the spa opportunity is a great way to use the aromatherapy without doing hand massages. I think we know now that as loved ones begin being and visitors become welcomed into our communities, whether they've been vaccinated or not, if the resident wants to wash their hands, put on a mask, and give their loved one or their friend a hug, that's allowed in the regulations as long as that resident has been fully vaccinated. So I think the same thing could apply. We certainly want to ask for permission. We don't want to just do it. But certainly if the resident is washing their hands before, the associate's washing their hands before, the associate and resident are wearing their masks, and you proceed with the hand massage, I think that's perhaps the way we can navigate around and through the regulations. I thought I'd take that rather than you, Jessica, but anything else you want to share?
Well, no, actually, as I was talking about massage,
the massage element during both this morning and just now, I thought about that. I don't know if they're allowed to touch the residents yet, not being in the communities, and I haven't even been able to visit my own grandmother, so I wasn't sure if you guys were doing that yet, but like Dr. Budensiek said, that doesn't mean that we can't try to take advantage of that by maybe using it in the bathtub or otherwise, right? And I wanted to back up about the mask. Depending on the type of mask, I did some events over the holidays, like small events when it was allowed, where we were, masked, but face-to-face working with the oil and customers could smell it right through their mask. Like you said, as long as it's not an N95 or something that's really sealing off everything, you should be able to smell something. I don't think you're putting those N95s on the residents. So they just usually have like So I found that, and actually, I don't know if this is something that would be permissible or smart within the elderly community, but as a staff member, I mean, I've put a little bit of oil on the inside of my mask and I love it. Like just a dab of lavender if I'm stressed or something to help me breathe better, because they can be so awkward when it comes to trying to breathe. So there's lots of fun things that we can do to ourselves with our masks as caregivers. So that's something to keep in mind.
Great point. Great point. And I don't know if any of our audience members have tried that, but I think one drop on the edge of your mask, and I don't think there's going to be any ill, especially if you're deciding to do it for yourself. So I think it's a great idea. Another shout out and thank you. Personally, Jessica has worked with Kim from St. Anne, Winona, for many years, and great products, great knowledge. A pleasure to see the growth within our long-term care at St. Anne's. So thank you. I think we'll have one more question here, and then we'll wrap her up. And this was another one this morning around, you know, what other things are optional as far as use of non-cotton ball items, and you know, sort of the things to look to avoid and things that we should consider if you're going to use anything other than a cotton ball, you know, for whatever reason. But again, it's the most simple, cost-effective, and you know, not real exciting, but it works great.
Yeah. So in it,
I just wanted to let you know I put my email and my phone number up there on the screen, and my website, and also a code that all BHS employees have always had access to this. And I don't know if you know this or not, but please share with your other employees that all BHS employees do get 15% off retail at my website using BHS15 at checkout. But to answer your question, Neil, the things to avoid are so I know one community was at one point making like something out of wood, like little wood medallions. And they wanted to put the oil on the wood. And I said, that's a great idea. You know, wood is actually a great diffusive material. It'll hold on to the oil and slowly release it. But we want to avoid things like adhesives, lacquers, stains, finishes, things like that, because essential oil is very powerful. They are chemicals. They come from nature, but they're still chemicals, and they will mix and react with other chemicals, and that could potentially create an off gas that's not good for your resident. And so just keep that in mind when you're using oils on different things. I do know that there's diffuser bracelets. I sell diffuser bracelets, diffuser necklaces, lots of different types of aromatherapy gadgets out there. I think they're all great. I don't necessarily think they're all great in the elder care community, because they lose them and they break them and they share them. And so I like to really just stick to the basics using the cotton ball. I know that there's sticky felt and fun little, you know, shapes and different things that people have used over the years, where they'll put a drop of oil on the felt and then stick it to the shirt, and or make it fun with these little felt gadgets. But again, I like to just remind people that there's dyes and adhesives in there, and so just to be careful that nothing that you're putting on there is going to like cause it to bleed onto their clothing or react with the adhesive and so on. So again, if you ever have questions, you can always email me about things like that. If you need to place an order or need to replenish your supplies, or if you want a more in-depth training because your community you think your community would benefit from it, you can reach out to me via email or give me a call. And again, like I said, always available for random questions if you have them. And yeah.
Great. Well, thank you, Jessica. Again, wonderful presentation. Thank you for our audience's engaging questions. And as always, trying to come up with a simple, practical, sustainable solution that's a bit elegant and be able to be of value and support and comfort our residents, as well as our family members and our associates. So thank you again for attending today, the Aromatherapy Refresher. And we will wrap it up. So have a great day and be well. Bye-bye.
thank you.